I want you to know that establishing kind of an accurate due date is important for a couple of reasons. So having an idea of where you're at can be useful because I talked about induction. Babies know when they're ready and all of that, and you don't want to be pregnant forever, right? So we want to have an idea of when it's coming, but it's used to determine certain pregnancy procedures or testing. So there's a gestational diabetes screening, which again, you guys can choose or not choose to do any of this testing, but these are the things that the date would be used for. Gestational diabetes screening, Group B strep, blood work that you might have, and knowing when it's safe to induce if you are facing some pregnancy complications like preeclampsia or something serious where they are talking about, actually, it looks like it might be safer for baby to be out than in.
Getting pregnant and giving birth are two of the most exciting things you can ever hope to experience in this life. The moment you think you could be pregnant, you're frantically searching for all the best information, which is why you're here today. I'm Stephanie King, and with my many years of experience as a professional childbirth educator, doula, and lover of all things pregnancy, birth, and postpartum, I'm here to make preparing for your birth enjoyable, empowering, and totally easy. Each week, I'll cover different topics, interview professionals, and get into the nitty-gritty birth stories from mamas just like you. And when you're ready for more, you can join me in the My Essential Birth course at myessentialbirth.com, where I take you step by step through exactly how to prepare your mind, body, spirit, and partner for a birth you love. So let's get started.
This week's reviewer of the week is from Jacqueline Crew, and she says, breech birth. Excellent information. I had an at-home breech birth with my first, only 6 hours, and I was expecting some of the normal pushing feelings everyone talks about and was a little confused and very exhausted by the end. Everything worked out and the midwife was extremely skilled, and our baby was born safely into our home. It was very reassuring and empowering, again, to listen to more of the technical details of how the breech birth works. Thank you for sharing all the information you do. Keep up the great work. That is so cool. I love it. I feel like we need to have some breech birth stories on this podcast, so maybe that's coming in the future. But today, I want to talk to you guys about due dates or guest dates in this case. And I want to talk a little bit about the evidence behind it too, everything that goes into it, kind of how to deal with your providers, and just all the things you guys are up against when it comes to due dates. So I want you right now to mentally be prepared to be pregnant for 42 weeks. Now, don't be mad at me for saying that, but I want you to know that your due date means nothing, literally nothing in the way of when you are going to give birth, except for when your provider is using that information to start talking about things like induction. Then it's like, okay, now we're talking about the due date and all of that. And of course, there are different things that the due date is used for in regards to tests and whatever's coming up during pregnancy. We'll talk about that too. But as far as knowing when you're going to give birth, it is a guess date. It is a guesstimate at best, and it should not be used as this hard and fast rule that is happening. So when I'm telling you, I think that you should plan to be pregnant for 42 weeks, I'm saying that so that you can get in the right mental space for passing that due date, because we put so much emphasis on this 40-week due date that when we hit it, even myself, I'm totally guilty of this. This is why I am recommending this to all of you right now. Even myself with my third baby, very aware that women go past 40 weeks. It is very common to go past 40 weeks. When I passed that due date, I was like, why are you still in there? Get out. Eviction notice, be gone. I am done being pregnant. And that's just not always how it works. And in fact, that baby was born at 41 weeks to the day. I had great support. There was no reason to rush anything. But for me, it was mentally exhausting that week. We also had some prodromal labor and stuff that I was dealing with, so that was a separate issue. But just the due date alone, it can be a little bit of a beast. So tell yourself, if you're due May 12th, that you're actually due May 28th, or whatever you need to do to just push that date out a little bit farther. I guess it'd be the 26th if I was saying 2 weeks, right? Anyways, okay, let's dive into it. So most providers, let's talk about how your due date gets scheduled in the first place. They use something called Nagel's rule. Now, maybe you've heard of this, maybe you haven't. It doesn't matter if you've heard the name. But what they do is they calculate your guest date or your due date off of your last missed period, or the first day of your last period. So if May 12th was the first day of your last period, then that is the date that they are going off of for your calculation for your guess date. So they go 40 weeks from the first day of your last period, 40 weeks from that day. That's why when you're really like only 2 weeks pregnant, in other words, like whenever you conceived your baby and you test positive in a couple of weeks and you're really only 2 weeks pregnant, you're calculated as 4 weeks pregnant. And so that doesn't change anything as I'm saying that. I don't want you to think like, oh, I'm only 2 weeks. It's just how it's calculated. So we're still going to call it 4 weeks. We're still going to base everything off of that. But the way that they're doing it with this Nagel's rule is assuming that every woman has a 28-day period and assuming that every woman ovulates at day 14 and gets pregnant at that time. So that's where that guess date comes from, just so that you guys know. It's called your EDD or your estimated due date. And like I said, it assumes all of those things. So if you've conceived with IVF, like when you know the exact date of conception, then that date would be used. In that case, then they would know very specifically. But if not, and hopefully you're at least tracking your cycles. So even if you're already pregnant, I want you to store this away in case this was you from last time and you didn't necessarily know, you didn't have good, like a good record keeping or whatever. Download a quick app or something like that. Write it down in your phone. Just keep track of at least what your periods are doing and how long they are at a minimum. But if you are tracking your cycles and you do keep track of ovulation, and it's not too hard to do, I didn't do this at all until we couldn't get pregnant after having my third. And then I really kind of nailed down, wait, am I ovulating? When am I ovulating? How long are my cycles? All of that stuff. And that's what told me, for example, so my cycles had always been like 31 to 32, maybe even 33 days sometimes. And they were pretty consistent that way, all growing up and into my childbearing years. And right before I hit age 30, they started getting a little wonky. They shortened. They were closer to like 28 days. Sometimes they would be, I'd have a 35 day in there and then I'd have a 26. And it started being a little bit different. There was a lot of consistency, but it was different for me. So what you can do though, is you keep track of your period. So you're like, okay, this is the day I started. And then you can do, and this is so simple, you guys, you take your basal body temperature in the morning. So before you wake up, before you get out of bed, and at the same time every morning. So if you need to set an alarm and you're like, I'm going to get up at 6 a.m. or 7 a.m. or whatever time you get up, you're going to set that alarm, stick the thermometer in your mouth before you get out of bed. So it should just be right next to your bed, and you keep track of that temperature. And so you keep track of when you started your period and your temperature. And what happens is when you ovulate, that temperature spikes and it stays up there. So, and there's different ways to find out, are you pregnant? Are you not? Whatever. But that is just so that you keep track of when you ovulate, so that you know when you ovulate. Now, if you keep track of those things and you're keeping track of, and we had sex this day and this day and this day, then you have a very good idea of when you get pregnant. And for myself, this is where I can tell you that I knew my due dates were just a touch off, because not only were my cycles longer, but I ovulated late. So when I was testing those things, I was ovulating at day like 19. Well, if you're putting me at 14, then that's 5 days earlier. So my guess date of 40 weeks is not 40 weeks after all. It's actually 39 and 2 days. So that can affect somebody if I hit my quote unquote 40 weeks, even though my baby is not even 40 weeks yet. And I know they can go longer than that no matter, when you ovulate. Then we could be talking about induction early, before the baby's ready, before my body's ready. And that's a big deal. That it really does affect things. Your body is smart. Your baby is smart. You know when to go into labor, or your baby knows when it's time to go into labor. They're the ones that send that wonderful signal and say, hey, I'm ready. Let's get things moving. And when we start interfering with Mother Nature, we don't always get to pick the consequences of that. So I do think it's a big deal when we're talking about due dates, and particularly right now with all the induction conversation happening, and quote unquote evidence-based research to back it. Guys, if you haven't listened to the Arrive episode, I'm going to make sure and post that within the story here, not the story, within the show notes here. I'll make sure and have that for you guys. But anyways, all of that to say, your due date matters, and understanding where it comes from and how to calculate it matters. Now, again, if you don't know the date of that last missed period, and this can totally happen, we don't always keep perfect track of our cycles. That's why I say just grab an app and hit the button that says, yes, I started my period today. But if you don't have that, they're often going to ask you to do an early ultrasound, and they'll usually want that between 8 and 11 weeks or 8 and 12 weeks. We've done some research on that. I've shared this on here before. We're including studies along here, and it is an accurate time. The most accurate time is actually between 9 and 11 weeks if you're going to do that. Now, there is some controversy either way. Like, do you really need extra ultrasound, and what effects does it have on the baby? And because we're not seeing things like deformities and whatever, we say, oh, it doesn't have any effect, but that's not a real thing. So if that's you, if you're somebody that's like, you know what, I really don't, like, I would hands off, whatever, then you just do your best guess. No one can force you into that ultrasound, even when trying to come up with a guess date. And you know what? Bodies are smart, and they kind of figure it out as they go. Like, if you choose to have that ultrasound later on, that's one way to do it. They can check HCG levels, which is just blood work. Eventually, you're going to hit that fundal height. Many women can, go right off of that fundal height. You'll have some kind of idea as well. So there's different ways to go about this. I just want you guys to know that you have options. You can also do the ultrasound and have kind of an accurate measurement if you do it between those weeks. But again, if you don't know when your last missed period was, you're hoping you hit in between those weeks. So keep that in mind too. Now, I want you to know that establishing kind of an accurate due date is important for a couple of reasons. So having an idea of where you're at can be useful because I talked about induction. Babies know when they're ready and all of that, and you don't want to be pregnant forever, right? So we want to have an idea of when it's coming, but it's also determined or used, that date is used to determine certain pregnancy procedures or testing. So there's a gestational diabetes screening, which again, you guys can choose or not choose to do any of this testing, but these are the things that the date would be used for. Gestational diabetes screening, group B strep, blood work that you might have, and knowing when it's safe to induce if you are facing some pregnancy complications like preeclampsia or something serious where they are talking about, actually, it looks like it might be safer for baby to be out than in. My guess is if you're experiencing something like this, they're going to call for ultrasounds anyways. And at that time, maybe you can decide if that is the best course of action for you at that time. And before that, maybe you don't need it. And that's just totally up to you. So with all of that, how long is pregnancy really? Is it really 40 weeks? And for those of you that have done this before, been pregnant before, given birth before, you know that it can be kind of all over the place. So let's talk about some of the evidence and studies behind these guess dates and where women fall. There's been 2 studies, significant ones that have been done. One of them found that 50% of first-time moms gave birth by 40 weeks and 5 days when left alone to go into labor on their own. 75% of first-time moms gave birth by 41 weeks and 2 days. So still past the 40 weeks, still not hitting 42 weeks yet. This study also found that 50% of moms who had given birth prior, so they've had a baby before, gave birth to this baby by 40 weeks and 3 days. So even moms who have had babies before can go over, totally normal. That's a very normal thing. And 75% of those moms gave birth by 41 weeks. So if you've had a baby before, 75% by 41 weeks. And again, not that perfect 40-week date that every provider seems to be looking for lately. I will tell you with mine, I kind of did the backwards thing. Or I don't know, my body just is like, no, we're going to do the opposite just to throw you off. So we say, right, if you've had a baby before, that it's really common that your next baby comes a little bit earlier and your next baby comes a little bit earlier. We see averages that show that. So what does that tell us? Don't put a lot of stock in that guess date, and do know that it is actually normal for your body to go into labor on its own past 40 weeks. Extremely normal and still safe, totally safe. So obviously I'm going to say that, and there's going to be some concern there that I'm spouting all kinds of things. It is safe provided you're healthy, low risk, there's no issues. Obviously, if we are just talking about a due date, it is safe to go past your 40 weeks due date alone. I want to make that clear. There's also studies that have been done that indicate genetics contribute to about 50% of your chances for a post-term birth. I don't know how much weight you want to put in this, but I do think it's interesting. So with my body, for example, my first baby was born, and mind you, he would have been born a little bit later. I don't know. He could have been born days later. The more I think about it, the more I understand about birth. So that labor started with just this like tiny little trickle. My water was like quote unquote broken. But the thing about waters, it's so interesting, you guys. You can like spring a little leak and it can seal up again. And so I wonder if I hadn't gone in, I mean, maybe we would have continued things anyways, either way. I did lose my mucus plug and stuff that morning, but I wonder if I didn't go in and things did fizzle out, like if I would have even really known that it was broken, if it would have sealed back up. Just interesting. But anyways, aside from that, that baby was born and it was via cesarean on a Friday afternoon. That baby was born, I think he was born 3 days early. So he was 39.4 when he was born. And my next baby was born on his due date to the date, which I feel like never happens, right? But that was really interesting. And then that last baby a whole week later. So whereas normally it goes, shorter, my pregnancies went longer. And again, I don't know, really could have had to do with my ovulation pattern. Maybe I did ovulate earlier, when I was a little bit younger and for the first pregnancies, and then that ovulation date changed. I don't know because I wasn't tracking it until after my third and we were trying to get pregnant. So anyways, all kinds of things there, but just know it's normal to go past 40 weeks. Now, what does this tell us? It tells us not to put a lot of stock in that estimated due date. It's good information, but we're not going to count on it being when we're going into labor. It is what it's called. It is an estimated due date, even though I swear that is not used as much anymore. Now, there's also been studies that have been done that show that your genetics it contributes to like a 50% chance of your post-term birth. For example, that influence is supposed to come from both your mom and your dad. So if you've had a previous pregnancy go past your due date, then it's likely that you can have another one. But if you have a family history, like your baby's father's family has a history of giving birth past their due date, that can influence it. I don't know how much stock you guys want to put in this because it really at 50% is like a toss up. It doesn't. So that's kind of one of those things like when you go ask family members, like, how long was your labor and what did it feel like? And did you need a cesarean and all those things? And it's like, maybe some of it plays a part, but you are your own person and the person that you're with has their own genetics and this baby is growing this particular way. I don't know, but it's interesting that studies have been done. And so that they do say, yes, if your sister, your mom or whatever went past date with their pregnancies, there could be a 50% chance or a maybe greater chance that could be a little bit about your story too. I think the benefit of knowing that and maybe speaking with a provider about it is kind of having that on your side. Whether or not it holds true for you is just to be able to say like, look, my mom, like she had post-term babies with all of her babies. So I kind of expect to do the same. And you know what's interesting about that is I wish that they would go back with these studies and like if we could keep track of ovulation and then see how that matches up to these quote unquote post-term babies, that is I think where the magic would happen, but that's not what that study did. So it is what it is. Some other things that might contribute are a higher BMI before you get pregnant, higher weight gain during pregnancy, advanced maternal age, or in other words, being past the age of 35, first-time mom, being a first-time mom, we know that first-time moms tend to gestate a little bit longer, and stress towards the end of pregnancy. So you'll hear people, especially, I feel like this is what I'm hearing, at least like moms who are at a birth center or planning for a home birth, and they're using a certified professional midwife, which if you know much about that, they really cannot assist women unless they're in a place where they don't have the like the certifications and stuff on purpose to be able to assist these kinds of births, but they really can't assist women past 42 weeks, depending on which state you're in and what the policies and stuff are there, what the laws are. And so moms get really stressed as they're like, I've passed 41 weeks and I don't want to have to transfer to a hospital. This has been my birth plan the whole time. And so that's when we start, castor oil and we're doing nipple stimulation and anything that we can do to get the birth started. But what's interesting is a lot of times that stress is actually what's keeping baby in. And so you'll hear like midwives say, just go for a weekend getaway, snuggle up with your husband, put it out of your mind, relax, don't do anything to try to go into labor, just chill. And guess what happens? It is so crazy how often that actually happens. Mom will go into labor. So that stress can absolutely keep things from happening. which easier said than done. We'll just relax, especially at the end of pregnancy and for all the reasons. It's just not that easy all the time, but it can help if we can find a way to relax. So why are doctors so concerned about moms going past their guest date and specifically past that 42-week mark? Now, this next part is all from ACOG, which is the American College of Obstetrics and Gynecology. I don't hold them to necessarily the king standard. It's not the gold standard by any means. They definitely have things that weigh on their opinions, and other places have their own as well. But they are somebody that we can go to, and they have very common guidelines, and in some ways lean towards the mom and safety of mom and baby. Without getting into all the details of that, this next part is from ACOG. So they say, while these risks increased as you go past your due date, most women who give birth past their due date have uncomplicated labors and give birth to healthy babies. So that is important to note. The risks that providers are concerned about, and what ACOG states, is stillbirth, a large baby, post-maturity syndrome, and that's when a baby stops gaining weight after their due date. Usually it's due to a problem with inadequate delivery of the blood to the fetus through the placenta, and that can lead to malnourishment. And so when you see a baby that is really like a post-term where they've got some placental issues, that's a baby that looks like they're born and they kind of look like an old woman or an old man. Like their skin isn't plump. It's really, it's just kind of like saggy, and like you can see like they have been malnourished. It's not common, and there are ways to take a look at the placenta and make sure that everything is okay, but it can happen. Meconium in the baby's lungs, which can cause breathing problems after birth. However, meconium can happen prior to that 40 weeks as well. It doesn't only happen with post-term babies. Decreased amniotic fluid. So this can cause the umbilical cord to pinch and restrict the flow of oxygen to baby. And then stillbirth is the one that providers really like to throw at moms to scare them into inducing. So let's take a moment and talk about that. While the risk of stillbirth does rise slightly each week, starting around 37 to 38 weeks, it is still relatively low. And so I'm going to give you a couple of numbers so that you can look at that and think about it and weigh it for yourself. So at 41 weeks, you're looking at 1.7 per 1,000 births, where we're talking about stillbirth. And at 42 plus, it's 3.2 per 1,000. So you can see there is an increase there. And a lot of the times what you'll hear is, your risk of stillbirth doubles after however many weeks. And that's something that providers say. And it is true. But it's not that it becomes there's a 50% chance. And so that matters as well. The other thing that is not put side by side with those numbers, and not to say I'm very aware, and I know that you would be aware of this too. If that percentage, or if that baby was your baby, and it doesn't matter all the data and whatever else, that is you that has to deal with it. It's you it's going to affect. And so those numbers are very real for every mom to take into consideration. But the other side of things that they don't talk about, or that we don't discuss as much, is what are the other things that happen if you don't allow mom to go into labor on her own? And do they pose risk to mom and baby? And the answer is yes, some of the things that we start to do can pose risk to mom and baby as well. So you still have, if we decide that, we are afraid of stillbirth and we want to do something about that, then what are we going to do? And that's where we start talking about things like medical induction. And medical induction has its own set of risks, including an increased chance of intervention or other things that have to happen during the birth, including an increased risk of cesarean. And those of themselves, right, don't sound like they're too terrible or anything like that, but there are risks associated with those things. And it's also not just the risk of that cesarean, but it's the risk of the impact that will have on births moving forward, and the risk and impact that it has on the baby long term. It is different for a baby to go through a vaginal canal and have fluid expelled through the lungs, and the fluid that hits the baby all over, the microbes and all of that stuff that happens through the natural birth process, versus doing something a little bit more medicalized. There's also how the mom feels about it, how she's made to feel about the situation, and wondering, did she do the right thing, and how many babies she wants to have after this, and is VBAC going to be in the works, or it just there is more than just saying, well, because of stillbirth we need to do X, Y, or Z. And so I think it's important that moms have that information. And so you can kind of ponder on that and think about it and see what your options are and be with a provider that gives you options. What I do think is really interesting and why I think it's so important that you have a provider that you love and trust is you can go to one provider who at 41 weeks is telling you everything's fine. We're just going to keep an eye on baby. You keep doing your thing. No big deal. And you can go to another provider, the same woman can go to another provider and they say, this is extremely dangerous and you are putting your baby at risk. And I can't support that. We have to start talking about induction. It is the only safe thing right now. Those are opinions. And that matters because that can completely affect how a mom feels about her birth, how she feels about her birth space, how she feels about her body, how she feels about the whole process, as well as the decision making that's going to happen. And if you have one person saying that this mom is safe and whatever, and the other is not, it comes down to opinion and support. So it really does matter which provider you are with. And that is, if I could drive anything home, that would be it right there. More than your due date and everything else that we're talking about, that is going to be your biggest thing. Now, as your pregnancy moves on, oftentimes providers are going to want to see, like if you hit that 40-week due date or whatever, and they are concerned, stillbirth or whatever the case may be, something that they often recommend is a non-stress test. And so that is something that mom and baby can go do and test. And if everything looks fine, then you can keep going. That's an option. You do need to know that non-stress tests can also pick up things that may or may not be an issue. And so that is important too. How a midwife out of hospital would handle that versus how an OB would handle that is going to be different. So again, different providers, same person, could be a different outcome. So all of that, is just information. And then it is important if whether or not you pass your due date, if at any point during pregnancy you are feeling like something's off, it doesn't feel right, I want a little bit more information, or there's just, call it mother's intuition, it's very real, then make sure that you're getting those things checked out and make sure that you are feeling good about whatever you decide to do moving forward. Now, kind of concluding this episode right here. Again, that 40 weeks is just a guess date. Yes, there are things that happen after 40 weeks for mom and for baby. Yes, that's a conversation that you can have with your provider. But remember, every woman is going to be different. Every pregnancy is going to be different. So even if things went one way for you one time, they could be completely different the next. So keep that in mind. And remember, it is such a mental game hitting that 40 weeks. That is why I'm telling you right now, pretend that you're going to be pregnant for 42 weeks. You will feel more at peace when you hit 40 weeks, I hope, because some of us still won't. So try and aim for that. And know that you will not be pregnant forever. No matter what happens at the end there, your baby will come and you will get to greet and meet that new little life, and it'll be the best thing ever. So with that, I will see you guys all next week.
If you loved what you heard today, the very best way to support this podcast and help other moms to find it is to leave a quick review. I read one at the beginning of the episodes, and I would love for yours to be next. And if you're ready for even more pregnancy, birth, and postpartum goodness, come join me in the My Essential Birth course at myessentialbirth.com, where I will hold your hand and walk you through pregnancy and birth step by step so you're totally prepared for a birth you'll love. See you next week.